And with that, let's get started for today on today's presentation. Today, we're here to talk about your 2023 plan benefits and provide you an opportunity to hear from TRS, Blue Cross Blue Shield of Texas, and CVS Care. First, you'll hear from Dina Hugler at Blue Cross Blue Shield of Texas, followed by Edwin Estradada at CVS Caremark. Then, we'll hold a question and answer session to hear out your questions aloud. We'll also try to respond to put some poll questions during today's presentation and encourage you to participate on those. This will keep the webinar more engaging and allow us to interact with all of you. All right, now before we dive into the presentation, I'll push out our first poll question for the day. And as you can see, the poll question is, what are you interested in learning about in today's presentation? Is it medical benefits, prescription drug benefits, or enrollment and eligibility? As I see the responses are coming in, I'm going to keep the poll open for a few more seconds to give everyone a chance to participate before closing and sharing the results. All right, a lot of you have already responded. So let's see. A large majority of you are here to learn about your medical benefits, followed by prescription drug benefits. So I want to say you're in the right place because we will be covering each of those topics for today's presentation. Okay, before we dive into your medical and prescription drug benefits, I want to share what's new next year. We're excited to share the good news that starting January 1st, 2023, formulary insulin are capped at $25 for a 31-day supply and $75 for a 60 to 90-day supply. You do not have to meet your deductible first or pay the full cost of insulin. You only pay a copay, which does not apply towards your deductible, but it does count towards your maximum out-of-pocket. We also lowered the age limit for colonoscopies. Starting January 1st, TRS-Care standard lowered the age for colorectal cancer screenings from age 50 to 45. So now TRS-Care standard participants can start doing these important screenings 5 years earlier. We also added diagnostic imaging of the breast. Starting January 1st, diagnostic imaging of the breast, including diagnostic mammograms, ultrasound imaging, or magnetic resonance imaging, is covered at 100% of the allowable for all places of treatment. And finally, we're pleased to share virtual visits through Teladoc, where you and your covered family members have 24/7 access to licensed, board-certified doctors for medical and behavioral health services. You can also get prescriptions sent to your pharmacy if needed. For 2023, Teladoc charges $42 per visit, which applies towards your deductible. After you meet your deductible, the plan pays $24 and you only pay $6. Additionally, ReadyMD has been added as another virtual health option for you. All right, with that, let's hear from Dina Hugler at Blue Cross Blue Shield of Texas.
Thank you. Hello, everyone. My name is Dina Hugler, and I'm the Blue Cross Blue Shield account manager for the TRS-Care standard plans. Today, I will go over your 2023 medical benefits, talk with you about your TRS virtual health options, and discuss ways to get the most value out of your TRS-Care standard plan. Before we dive deeper into our presentation, here's a quick refresher of your benefits. Your preventive services are still covered at 100%, but you will pay out of pocket for in-network medical and prescription drugs until you meet the deductible. Teladoc physicians are board certified, and most Teladoc doctors for TRS practice in Texas. They treat a wide variety of non-urgent conditions like sinus infections, bronchitis, allergies, pink eye, the flu, and more. Teladoc doctors order prescriptions when you need them. Keep in mind, if you need stitches or have a sprain that needs wrapping, Teladoc is not the right choice for care. Teladoc is also happy to share information about your visit with your primary care doctor. You can request a phone or video visit or on demand or schedule time with the doctor to call you. The average time between the visit request and when the doctor contacts the patient is just 11 minutes. So that sure beats sitting in a waiting room for an hour or an ER for several hours. And you're not sitting and waiting with a bunch of sick people. You can also download the Teladoc mobile app from the Apple App Store or Google Play Store. The app makes the experience even easier. Make sure you complete the registration. It's like filling out your health history for any doctor appointment, only you can do it ahead of time when you're not feeling bad. Please register for Teladoc and ReadyMD in advance so it's available when you need it. So now we'll go over the virtual mental health services. Teladoc offers visits with psychiatrists, psychologists, licensed social workers, counselors, and therapists who treat many mental health and chemical dependency conditions. Please keep in mind that the patient must be at least 18 years old. Scheduling a visit is simple. You request the visit online or through the Teladoc app at least 72 hours in advance. You can choose to see the provider you want by viewing their profile and get to know what they specialize in. All consults have to be done through video chat. You are able to see the same provider each visit or select a new one. This is convenient and the cost is less than visiting a psychiatrist or therapist in an office. The initial psychiatrist visit is $185. After that, the sessions are $95. If you're seeing a psychologist, licensed clinical social worker, counselor, or therapist, the cost is $85 per session. These amounts are before the deductible has been satisfied. For example, you would only pay $19 per session for an ongoing psychiatrist visit and only $17 per therapist session after you have met your deductible. I would also like to add that psychiatrists are the only providers that can prescribe medications. Okay, next slide. Great, thank you. The Teladoc caregiver benefit enables you to extend the Teladoc medical visit benefit to family members that are not enrolled on a TRS-Care standard plan. The eligibility criteria includes the following. You, the retiree, must be a caregiver for the family member. Family members can include adult children, a spouse, or elderly parents. Family members must be 18 years or older, and there is a requirement to confirm the caregiver relationship. To schedule the appointment, you will enter the family member's information, including their email address, into the Teladoc portal on the My Family tab /add a care recipient. Teladoc will email the care recipient for authorization. Once you or the care recipient fills out the health history An appointment can be scheduled on the website or through the app. The visit can be a phone or video consult, and the cost of the visit is just $45. Now that we've provided a overview of virtual visit benefits, we want to take a quick poll. So the first poll is, I can use the TRS virtual visit benefit for any of my dependents, regardless of their age. Is that true or false? So we'll give you a minute to click on the poll. So do we have the results of the poll? There we go. That is right. That's correct. The answer is false. So the next poll is, can I use the TRS virtual visit benefit for mental health conditions? Yes or no? So we'll pull up the answers in just a minute when everyone finishes. That's correct. Yes, you can use the virtual visit benefit for mental health conditions. Okay, next slide. Preventive care services. I want to take the opportunity to stress the importance of getting regular annual checkups. As a reminder, preventive care is covered at 100% with no out-of-pocket cost owed when you use in-network providers. It is also important to remember that lab tests related to an illness or condition, such as diabetes or asthma, are not considered preventive and are covered under applicable deductible and coinsurance levels. This can create confusion for you since these tests often feel routine. Even though you're not required to have a PCP on file, it's important even if you rarely go to the doctor or get sick. For starters, your PCP is the single best resource for knowing and understanding your health. This includes knowledge of your personal health, your family history and risk factors, the medications you're taking, and your overall lifestyle. He or she can make sure you're getting the care you need and are up to date on any age, gender, preventive screenings, or immunizations. Your PCP can easily treat many non-urgent health issues like colds and flus, rashes, allergies, and respiratory infections in the event you get sick. Also, the cost of seeing an in-network PCP under your plan is significantly less than going to an urgent care facility or an emergency room. Seeing a PCP for health issues is one of your lowest cost options of care. So now let's look at in-network versus out-of-network providers. Advantages of staying in-network include receiving the highest level of benefits, which means keeping more money in your pocket. You don't have to file any claims forms. Providers do that for you, and balance billing is not allowed. You're protected from balance billing, and you can have added peace of mind. When you go out of network, be aware that benefits pay at a lower level, meaning you pay more out of pocket for care. You will probably have to file your own claims, and providers have the ability to balance bill you. So now that we've provided an overview of the in-network and out-of-network benefits, we want to take another quick poll. Your benefit levels are the same for in-network and out-of-network providers. Is this true or false? Give everyone a chance to vote. False. That is correct. Okay, we're going to take one more poll. Preventive care services provided out of network are covered at 100%, no copay, and no deductible. Is that true or false? And I'm singing the Jeopardy theme song in my head as we look at the screen. I wish I had that music on. So we'll give you just a minute to vote. And the answer is false. That is correct. Okay, next slide. So we're going to go over the participant website. This is a very important web address for you to have. The TRS-Care Standard website should be your first stop for medical benefits and any health and wellness information. It is dedicated to the TRS-Care Standard plans and has coverage-specific information that will be helpful to you throughout the year. The participant website features options to find an in-network doctor, hospital, or other provider, get plan information, get the latest news and updates, download forms and documents, and learn about health and wellness resources, register for Blue Access for members, check the cost of doctors and services covered under your plan, and you can also download a temporary ID card. You will be able to access the Blue Access for Members participant portal by logging on to the web address at the top and clicking on Login at the top right-hand corner of the homepage shown here with the green circle. This portal allows you to find information related to your medical coverage, finding a doctor, claims, prior authorizations, download temporary ID cards, and links to various health and wellness programs are available. When you first sign up, you will need to have your member ID number to create your personalized account. If you don't have your member ID number, you can contact a personal health guide at 1-866-355-5999. Additionally, this website is available in English and Spanish, and we will go over that phone number again at the end of this presentation. Next slide. Okay, now we're going to go over Provider Finder. On the left here, you see a screenshot of the Blue Cross Blue Shield of Texas Provider Finder within the Blue Access for Members portal. This is a tool we encourage you to use when selecting a physician. It is important to note that when you're searching for an individual physician's name, that you search for him or her by their first and last name, even if they are part of a larger physician group like Austin Regional Clinical or Kelsey-Seybold Clinic. When you search for a provider, you get more than just a list of doctors. You get quality designations for facilities and physicians, including awards and recognitions, enhanced demographic information on each provider. You can find out about a doctor's education, hospital affiliations, and whether they are board certified. Customizable search options, such as referring a doctor or preferring a doctor who is a woman or one that speaks Spanish. You can see patient reviews, find out what others have to say about that physician. You can look for an alternate location. Does the doctor practice at multiple locations? Find the one that's most convenient for you. After completing a search and clicking on the provider's name, it will take you to the detailed provider page, which is shown here on the right. This tool is also available in Spanish and English. So we also have mobile access. The Blue Cross Blue Shield of Texas app allows you to find the most important information quickly and easily. You can use the app to check claim status, track deductibles and out-of-pocket maximums, view prior authorizations, and out-of-pocket spending. If you have an iPhone, you can view your ID card and add it to Apple Wallet. You can even email your ID card to providers. The Blue Cross and Blue Shield Texas app also is available in Spanish for both iPhone and Android users. With Blue Access for members and the Blue Cross Blue Shield of Texas app, your benefits are at your fingertips wherever you are. This allows you to stay informed and better manage your health, wellness, and benefits. Now we're going to go over ID cards. This year, new ID cards will be issued to everyone. The image shown here is what the new cards will look like. However, existing participants can continue to use your old card. Each covered family member will receive an ID card. If you're a spouse or dependent, your card will also include the retiree's name, also referred to as the subscriber. You can order additional or replacement ID cards via Blue Access for members in the participant portal directly through the Blue Cross Blue Shield of Texas app or with a dedicated personal health guide. Now that we've provided an overview of the website and mobile app, we want to take another quick poll. The mobile app will show me my prior authorizations and referrals. Is this true or false? Letting everyone vote. Okay, what did everyone say? The majority said true, and that is correct. The mobile app will show you your prior authorizations and referrals. Okay, next question. We're going to have one more poll. Will existing TRS-Care participants receive new ID cards for the 2023 plan year? Is this yes or no? Will you receive a new card in the mail? What does everyone think? Yes is correct. You will be receiving a new ID card in the mail. Okay. Thank you, everyone. Now we're going to discuss our wellness resources.
Hello and good afternoon, everyone. My name is Marissa Riles. I am the Senior Wellness Consultant for Blue Cross Blue Shield of Texas. And it is my pleasure to present an overview of the wellness resources. Let's begin with one of our most comprehensive and engaging wellness programs, Well on Target. The Well on Target portal is where you will start engaging in wellness activities that are personalized for you. There are many activities on Well on Target to encourage you and help you along your wellness journey. Activities include taking a health assessment, various trackers, syncing a fitness or nutrition device or app, self-management programs on key health topics, and even access to a personal health coach. Well on Target is also available in Spanish. You can also earn Blue Point rewards by participating in qualifying activities on the portal. Let's learn more about Blue Point rewards on the next slide. These built-in rewards are called Blue Points. On this slide are a few qualifying wellness activities that earn Blue Points. You can redeem your Blue Points at our online shopping mall with over 1 million products, from electronics to home and garden to sports equipment. There is something for everyone. And a great feature about the points is that they never expire and they roll over from year to year. Did you know you can earn Blue Points by participating in the fitness program? Let's learn more about the fitness program on the next slide. The fitness program provides tiered membership options for unlimited access to more than 10,000 participating facilities nationwide. You can choose a membership plan that works best for you and your budget. You will have the option to select between 4 tiers, which are base, core, power, and elite. And regardless of which tier you select, a one-time initiation fee will be the same across all 4 tiers. You can access the fitness program network to locate gyms and fitness centers under the Wellness tab on the Blue Access for Members homepage. Remember, Blue Points can be earned for joining the fitness program and based on frequency of gym check-ins. Guiding you to the appropriate level of care is critical to supporting efficient and effective healthcare. Let's learn more about 24/7 Nurse Line. Another great offering we have for you is a 24/7 Nurse Line. We have a nurse line staffed by registered nurses 24/7 to conveniently assist you with your health questions. Nurses can answer general health questions and guide you to the appropriate level of care, whether it's a visit to your PCP, virtual health provider, urgent care, or the emergency room. They can be reached 24/7 at the 1-800 number listed on your screen. This phone number is also located on the back of your Blue Cross Blue Shield ID card. Now that we have provided an overview of the wellness resources, we want to take a quick poll. I can earn Blue Points by taking the online health assessment through Well on Target participant portal. Is this statement true or false? Okay, and thank you for participating in our poll. The correct answer is true. You can earn Blue Points when you complete your assessment. Do we have another poll? Yes, we do. Okay, if I sign up for the fitness program, I can only access gyms in my hometown. Is this statement true or false? Okay. Let's see. The correct answer is false. When you enroll in the fitness program, you will have access to over 10,000 participating gyms and fitness facilities nationwide. Now let's take a look at our final wellness slide. One of the most useful resources available to you are the Blue Cross Blue Shield of Texas Personal Health Guides. They are here to help you and your covered family members with questions you may have on your benefits and coverage, such as checking the status of prior authorizations, helping you understand your healthcare costs and options for care, scheduling appointments for your doctor visits, and helping you navigate the participant website and mobile tools. along with connecting you with a nurse to help you learn more about a diagnosis or medical condition and identify resources available to you in your community. Remember, there is one toll-free number to call, and that number is listed on your slide. It's also listed on the back of your ID card. That number is 866-355-5999. A Blue Cross Blue Shield of Texas personal health guide is available to assist you 24 hours a day, 7 days a week. So this concludes the Blue Cross Blue Shield portion of the presentation. And now I will hand it over to CVS Caremark. I will be available at the end of the presentation to address any questions you may have. Thank you.
So I will be taking over the screen now. Give me 1 second while we switch screens. All right. Hello, everyone. My name is Edwin Estrada, and I'm with Caremark, the Prescription Drug Coverage Administrator for TRS-Care Standard. Today, I will be going over your prescription drug plan and providing you with cost-saving tips. Here is an overview of the prescription benefits for the upcoming plan year. We are pleased to announce that there will be no plan changes. Once a participant meets the deductible, the participant pays a set copayment or percentage of the drug cost coinsurance for each prescription. The amount the participant pays depends on their plan, whether they use retail pharmacy, retail plus, mail services, and the type of drug, whether that's a generic, brand, or a specialty. All right, time for a poll. Is there a deductible for prescription drug benefits with the TRS-Care Standard plan? And the answer is yes. There is a $1,500 individual deductible and a $3,000 family deductible. Caremark.com makes it easy for members to manage their medication from their desktop or smart device. Once you register, you can review your plan details, see how much your medications will cost, and find ways to save. Find pharmacies and plan networks, refill mail service prescriptions, view prescription history, and see your progress towards meeting your deductible and out-of-pocket. If you had a CVS Caremark prescription benefit last year, then you can register at any time. All you need is your member ID number. It's on your prescription ID card. Just remember that you won't see changes for the upcoming plan year until the start of January 1st of 2023. Medications on the preventative drug list are covered under the plan at no cost from day one and bypass the deductible. Preventative medications help manage certain health conditions like high blood pressure, diabetes, and high cholesterol. This list also includes medication that can help you quit smoking and prepare for certain health screenings. Members can see a full list of the preventative medication at info.caremark.com/TRSCareStandard.com or call the CVS Caremark number at 844-345-4577. I'm going to paste the link, which I just read out loud to you, on the chat page. And it is posted, so if anybody wants to check out the list or any other drug list, you can click on that link. Maintenance medications are medications commonly used to treat conditions that are considered chronic or long-term care. These conditions usually require regular daily use of medicine. TRS-Care Standard offers a Retail Plus network, which lets members fill maintenance medications they take regularly, like diabetes, asthma, or high blood pressure medications, in convenient 90-day supplies. Members can find a Retail Plus store by going to our dedicated website, info.caremark.com/TRS-Care-Standard, and click on the Find Pharmacy link, or by calling the 844-345-4577 number. Again, that link was posted on the chat. The good news is that 90-day supplies usually cost less and they're more convenient. Getting recommended vaccination is more important than ever. Members can get their no-cost flu, pneumonia, and shingles vaccines at any of the 68,000 pharmacies in our vaccination network of 9,900 CVS pharmacy locations nationwide. They won't need an appointment and can avoid an extra visit to the doctor's office. Members can log in at caremark.com or visit the info.caremark.com/TRS-Care Standard site to find a network pharmacy that provides vaccinations. You click on the Find a Pharmacy, enter your zip code, click an advanced option, click on Vaccine Network, and look for the syringe. Diabetic meter and supplies. Regular blood glucose testing is essential for members with diabetes. One of the best ways to manage diabetes is to check blood sugar every day with a blood glucose meter. The Diabetic Meter Program is a value-added program offered by prescription benefits plans that provides eligible members with a no-cost blood glucose meter to help monitor their blood glucose levels and better manage their health. Keeping a log of results is vital for controlling blood glucose and can help maintain a healthy lifestyle and stay out of the hospital. Staying out of the hospital ultimately helps keep costs down for the plan as well as for the member. TRS-Care Standard members are also eligible for free diabetic meters at no cost. Along with a free one-touch meter, the plan offers diabetic supplies at no cost. TRS-Care Standard members can get a 90-day supply of diabetic supplies at any Retail Plus store or a Caremark mail order pharmacy. The no-cost supplies include needles, lancets, syringes, and test strips. For tools and resources to help manage diabetes, members can visit caremark.com/managediabetes or call the CVS Caremark Member Service Diabetic Meter Team at 1-800-588-4456. I'll paste it in the chat box now. And it is in the chat box. All right, time for another poll. What diabetic supplies can you receive at $0? All right, and let's share the results. You can get a 90-day supply of needles, lancets, and syringes regardless of the manufacturer and preferred test strips. So supplies are at $0 cost. Questions a little tricky. Meters are at a $0 cost through the diabetic meter supplies. So it's a little bit of both of the above and needles, lancets, and syringes. We are pleased to announce that effective January 1st of 2023, the cost of formulary insulin is capped at $25 for a 30-day supply and $75 for a 90-day supply. We are working on communication campaigns to notify our members of the exciting change. Access to ID cards. We have several options for our members to get an ID card. Members can download the CVS Caremark mobile app, log in to the caremark.com and print a card, contact our customer service to mail a new ID card, or go to our dedicated TRS website at info.caremark.com/TRS-Care Standard and download a temporary card. Just a reminder, when members enroll in our mobile app, they can manage their prescription medication order refills, check drug cost, view the prescription ID cards, and locate a pharmacy anytime, anywhere. As we wrap up this presentation, I want to leave you with two really great features. The first is our dedicated website, info.caremark.com/TRS-Care Standard, which I'll paste in the chat box now. Tom there. It's a one-stop shop for all prescription management needs. You can print documents, check your drug costs, and find pharmacies in your area. The second is our customer care team, standing by 24 hours a day, 7 days a week. You can reach them at 1-844-345-4577. Press option 2. There's a dedicated team of customer care representatives based in San Antonio, and they know your plan. Please reach out to them if you need any help with TRS-Care Standard plan. Now we'll transition back to TRS to lead us into question and answer session. Thank you everyone for listening. We appreciate your time.
All right, thank you so much, Blue Cross Blue Shield of Texas and CVS Caremark for going over that detailed presentation and reviewing the 2023 TRS Care Standard Plan benefits.